Hi everyone, my name is Zara Khalid. I'm a general internist at in Hamilton, Ontario, Canada, and I'm going to share the story of my friend's project in Nakasake, Uganda. It's a rural district, and my friend Robert Kilisabula actually was in residency at the same time as I was, but he was in Kampala, and I was doing a global health elective there, and both of us were interested in global health, and he was interested in serving his community back in a rural district in Uganda called Nakasake, and where he had being an orphan himself had seen that that it is difficult to live in a vulnerable resource limited setting to get access to healthcare and education. So he, together with his wife, actually set up the program called Access, which is African Community a Community Center for Social Sustainability in the rural district, and the goal was to provide education, medical care, and economic empowerment to vulnerable population that was living there. And they created a very community-centered model where community members were on the planning committee, were on the design committee, and are constantly engaged in feedback as well as the day-to-day running of the committee. So even though the program has started and has collaborated with a lot of other people or other NGOs or funding models, or even individuals like myself who have helped the program from time to time in setting up any education models or funding donation or funding models. The program has maintained its independence and kind of kept true to that model of social sustainability. I think the strength has been that they have created schools for nursing and midwifery, as well as educated on other skill development that has allowed them to recruit people locally from the community to maintain their economic independence, as well as to have people within their workforce who know how the community works are embedded in the community's culture, as well as they have been able to provide the social value of providing healthcare to local members who would otherwise have to travel to far away to the cities to get access to healthcare. And I think being able to provide medical care in terms of non-communicable diseases such as hypertension or kidney disease, as well as providing palliative care to patients so that they can die peacefully at their homes, has had a strong impact on the health of the local community in terms of building a self-sustainable model. As well as they have built schools to provide education to children, especially who are orphans or are living in vulnerable situations where they would not be able to otherwise afford going to schools. They have built a very sustainable, subsidized model of education with very good quality of education being provided. I think overall the model is successful in giving it social value because of maintaining their independence, being community centered, and actually recruiting local people and empowering them with education and skills. And it's always been an honor to work with Robert on his sustainability initiatives, and he has also included now environmental sustainability to grow local food as well to maintain that sustainability model.